The information provided on Dr. Tom Rosell Live by Dr. Tom Rosell, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey everybody, Dr. Tom Rosell here. Welcome to Asia's Health live stream with yours truly. Got a lot of things to talk about today, leading up to a very interesting program that's going to happen at the Rosell Center in Fairfax, Virginia. Hope you'll join us. It's going to be a very interesting night, show and tell and demonstrations and so forth. Program is on the 19th at 6 p.m. at the Rosell Center for Healing. How you register for that, just go online. Right now, you may be looking at a way to make that happen, so you can do that real quickly. This program is going to be eye-opening. It's going to really let you know what your body's trying to tell you. You know, the signals that you're ignoring all the time, the things that you say, well, oh, that's not a big deal, and you try to take some. But anyway, you know, identifying your body's signals, if you will, and could save your life. And I say that truly, honestly. It could save your life, give you a better, longevity, quality of life, and so forth. But sometimes we ignore it. We take 2 aspirin or something else and try to dumb down the symptom presentation, and we don't know why we feel like hell. You know, when a patient comes in and I see them, and I have the privilege and the honor of treating patients from literally all over the world. I ask them a question. I say, 0 to 10 basis, what's your energy like? 10's your superwoman, Superman. And 0, I can't get you out of the chair. And they'll end up, in most cases, some, you say, oh my God, you're great. But some of them will say a 5, a 6, maybe 7 on a good day. And so the next question is, if you have the potential of being an 8, 9, or 10, why are you at that level? And why aren't you ready to rock and roll and take on the world and so forth? But more importantly, it's a signal that tells me that your body systems are not working the way they're supposed to work, and something is failing. So we need to figure that out. We need to put it together and make a difference so you can have the life that you want. So on the 19th here at the Rosell Center for Healing, we're going to talk about all those little things. Have you ever looked at your fingernails, for example? This is just a little piece of the puzzle. I talked about it a little bit a while ago on WMAL live stream, 105.9 FM. So if you have these little white dots on your fingernails, they show up and go away. It's called cholinitia. What does that mean? That means little white dots. But they are very diagnostic of something. That something is a low level of zinc in your body, and zinc is necessary in multiple places. So if your zinc level is low, guys, particularly you, why does it have an impact? Because in a healthy man, the dry weight of the prostate gland is 50% zinc. Now, some years ago, I wrote a paper called Zinc in the Prostate Gland, and I just updated it a while ago, and it's called Zinc, the Missing Link, because it's used in so many different places, from autoimmune to neurological transmission to healing, but all of those things. So if you can see that's a problem, and also they start popping up, and say, oh, it'll go away. Well, yeah, but it's trying to tell you something, that your body area is depleted. How about those leg cramps that you get just at the calf areas? What does that tell you? It could be a fatty acid problem, could be a calcium metabolism problem. There's ways of distinguishing that. On the 19th, we're going to go through that in detail. And so, one of the cramping areas that you get in your legs, sometimes if you take enough good omega-3 fatty acids and you take a low level calcium lactate with enough magnesium, within about 3 days, you're going to notice a big difference if that's the case. Now, each person is different because you got to rule things out. The swelling that you get, the pitting in that swelling, that tells you one type of problem and you can't ignore it. So you have to make sure that you understand what the body is trying to say to you. Right now, we have patients that are coming into the office and with all kinds of upper respiratory stuff and intestinal tract. If you'd listened to the program about 9-10 months ago, I told you there's this enterovirus that's going to show up that affects the gastrointestinal system. And there was a lot of conversations that saying that it was one of these corrupted viruses. Who knows? But the point of it is the enterovirus is a gastrointestinal problem that, is going to purge you both ways. A lot of loose stool, a lot of diarrhea, a lot of vomiting, and there's ways of calming that down. But you have to fix it because then you go into dehydration. There's homeopathics. When you have vomiting or purging either end, there's one that's called Nux, Nux Vomicus. You can look it up. It works actually pretty well. We've used it with our patients for many years. Has a tremendous impact. And you add that with some probiotic, and you take the stress off the dietary patterns. Make sure you stay well hydrated. Take a little bit of Celtic salt, if you will. How much? A quarter a teaspoon, third a teaspoon. Celtic salt. I didn't say sea salt. I didn't say any of that other stuff. I said Celtic salt. There's 74 trace minerals in it, and it will make a difference. So when you see that take place, there's things that you can do, but you have to understand where it's coming from, what's going on. If you have a really, really bad sore throat, which this upper respiratory thing often shows up with, it seems to be morphing, according to the literature, into different bacterial infections, strep infections. So what could you do? Well, there's things like strong liquid garlic extract. There's a company called Herb Farm that we use a lot of, and you hit it like 4 times a day, but you keep on it for a period of time. Now, we dramatically increase vitamin D levels in patients, but that's on a one-to-one basis. I have to know more about you, the patient, and so forth, and what we're dealing with. So let's get a little bit more into the weeds, if you will, with this, and so you understand how your body's actually talking to you. And if you're not paying attention, it could lead to other types of conditions and problems. Let's go back to the nails just for a second, right? So we talked about these little colonychia. There's also these little moons, which you've heard me talk about before. They're little kind of white moons, and they should be on every finger, including your thumb, except for the little one. When they're not there, it tells you that your immune system is depleted. It's pushed down. Not okay. You have to find out the other connections that are with it. Now, if you look and you see pale fingers, or purple fingers, and you look at the tongue and the tongue is red, the tip of it is red, that's a warning sign. Now start taking a look in other areas. If you go to the earlobes and you see these long, deep vertical lines, that's another finger pointing to the heart. So if you see this discoloration, you see redness in the tongue, you see these vertical lines, I would tell you and encourage you that you better go get checked out and do something about it. And then make sure you get the right testing done. We've talked about how your body talks. You can talk to you to lab tests, but most people misinterpret the lab tests. So when, we want to get a full cardiac panel, we just don't do total cholesterol and triglycerides and HDL and LDL and then the ratio. That's the drug company model. What we want to see is all of that, but we want to see subfractions. We want to see things like homocysteine levels. That has to do with an inflammatory poison that's in the system that can irritate the arteries. It's an indirect measurement of vitamin B12, B6, and folate. And so that gives us a finger pointing. There's something called coronary C-reactive protein. Some doctors will call it small molecule CRP. And if that coronary CRP is elevated, then the heart vessels are irritated. They're inflamed. They're on fire. So you have to look at all of those pieces to really understand what area of the body is involved. And if you act upon it and you change things accordingly, guess what happens? You can actually get better. Your body's extremely forgiving. So all of these external forces, if you will, these epigenetic inputs, these structural things, these biochemical things, the mindset and so forth, will cause your body to portray itself when it's not working if we're paying attention to what's going on. So, and we were kidding the other day, I've been pushing now the last, several days and so forth, and I've got to get some things done. So I'm not getting the rest of the sleep that I should have. And as you can tell with me, if you want to right now, is that I'm getting a little puffy in through here, and it's because my sleep cycle has been altered. And so, when that happens, we have to do damage control, and I'll get it done because I understand what happens. Unfortunately, I repair pretty quickly because I've taken myself through that process, if that matrix over a period of time. So look, here's the situation. You need to know how your body is listening and then communicating with you. If you don't pay attention to it, and you have to listen before it's too late, you're going to have major problems. Those headaches, that neck and shoulder pain that you get, the back pain, the knee pain. Here's one for your knee, right? Did you know that if you have knee pain, that it could be due to your gallbladder? Remember my world organ muscle patterns? Well, there's a muscle behind your knee. It's a trapezoid shaped muscle, and it's called the popliteus muscle. And that relates to gallbladder function. So if the gallbladder is not working properly, you may not have gallbladder symptoms initially, but you could have a knee that hurts you. It's painful. And they go to the doc and they say, well, your knee is swollen. And what do? They stick you with a steroid, or they give you a strong anti-inflammatory, or they combine that with a painkiller. And it actually over time makes it worse because you're not addressing why that gallbladder is being irritated. Now, minimally, you're going to end up with all the sludge in it. Then you end up with stones. Then you can end up with a tremendous blockage. Then you can end up with an infection. So wouldn't it be good to find somebody who can say, hey, this is why your knee, and you knew that there was a possibility that was there? Well, on the 19th, we're going to cover that. So guess what? We talked a little bit about this stomach pain, that gut feeling that you can get that's not right. Well, it's anxiousness. And I mentioned earlier on that it's an anxiousness about the future often when you get that feeling. There's no tumor, there's no cancer, there's no irritation, there's not any of that stuff. But your stomach hurts. It's like, oh, why is it doing that to me? That's an internal problem with even something scary like, oh my God, the sky is falling, it's Chicken Little, because all these talking heads have told you that that's what's going to take place. So you have to make sure that you're paying attention. How about that shortness of breath? Oh, I'm just tired, right? Well, maybe it might be, but it could be your heart, and it could be it's from a heartbreak. Something happened to you. It's you shoved it in the back pocket. You're not addressing it properly, and it can lead over time if you don't pay attention because of that overwhelming energetic. You could end up with a heart attack over a period of time. So look, if you begin to understand and you're willing, more important, to do something about it and change whatever it is that's going on and deal with, using the word confront, if you will, to step up to the plate, to do whatever is necessary to shift and change, you can resolve virtually anything. So, and, if you have pain, don't, don't shove it down. Years ago, my generation, right? We've programmed ourselves to do certain things. How about big boys don't cry, right? Or stop being such a crybaby. And it could be that you're just expressing an emotion. Anything like that carried too long is a problem, either way. But internalization of emotion is also a problem. Back in the day, I realized that I had to get rid of stuff. I played sports, and anytime I got upset about something, I went to the gym and I worked out hard. But I also grew up in a very Sicilian family where things were expressed at very high decibel levels. And when I first married my wife, I had to change my communication style because we get into something and I blow up, and then I was over it in 5 minutes and go back, and I left her in tears many times. And so I had to shift, and it was my culture. So I had to find a way to shift and offset that and go do something else so I didn't affect her. And so we all have the backgrounds that we go in, but we have to take that situation, but we can't internalize it. We have to express it. We have to be able to do something with it. Otherwise, we have a problem. We're going to end up in a deeper situation than we could possibly think about. So here's the deal. We have to find out what our body's telling us. So how do we know that? How do we know that, we have to have a heads up, right? So we have this paying attention thing. It's called introspection. So when we find something that is bothering us, and we ignore it. It gives it the opportunity to progress. I'll give you one that's very, very interesting. What happens if your sacroiliac is painful? It just kind of comes out of nowhere. What's going on there? But you notice that your sacroiliac, and you're getting a little bit of, every once in a while your heart is misfiring. It's coming from the same thing. The next place that's going to be affected is going to be your thyroid. You're going to start seeing loss of the outer canthus of the eyebrows. You're going to feel more sluggish over time. What am I talking about? So that sacroiliac problem is manifested because the muscle that holds it in position is now inhibited or weakened. What's the muscle? It's a muscle that starts in the front of your hip, way down in the front, and then goes all the way down to the inside of your knee. It anchors that pelvis forward. And it has to do with inside the adrenal glands, these little glands, ductless, that sit on top of your kidneys. You've heard me talk about it 100 times, but it's the inside of it. It's the adrenal medulla. And the adrenal medulla is responsible for heart regulation, blood pressure, and so forth, as well as your adrenaline, your noradrenaline, and as a group they're called catecholamines. Now, if you let that go too long, or if it's a reoccurring problem, it will affect other systems. What is it that they all have in common? It's an amino acid called tyrosine, L-tyrosine. So if you don't have enough L-tyrosine, or if it's speeding up because you're on a fight-flight reaction all the time, the first systems to go depleted are going to be your thyroid and your heart. Why? Because your adrenal system is what keeps you alive. And so you have to make sure that it goes there first. And there's a lot of other connections that are associated with that. But if you don't know that, you put up with irritation, back pain, leg pain, a sciatica that's coming from a fight-flight reaction that may be resolved simply, maybe if that's the case, by adding adequate amounts, and we use high amounts of L-tyrosine to get that adrenal medulla to start firing functionally, physiologically the right way. So those are like the little pieces that you have to look at. You have to understand how all of this kind of works hand in glove, works together, and it begins to show you, hey, there's a problem. Don't ignore me. Don't let it go. There's a guy that came in the other day, and he was talking about that he's having really, really significant problems with frequent urination. The stream is good, but he's got to go all the time. And, it's not just a little bit, it's a lot. So what does that tell me? You've got to start looking at other pieces of that puzzle. It could be a diabetic problem. And in his situation, we did it, the blood work, if you will, and there it was. His A1C, the 3-month average of hemoglobin or sugar in the body, in the red blood cell, was way above where it needed to be. He was in that diabetic place. And because his stress levels and his diet to keep on functioning, keep on going, were not the best. So he was able to identify quickly before it started causing other issues, because we were able to find it with him. But if you don't understand why early on, then the why becomes extremely damaging later on, and you end up with a disaster, everything from a diabetic problem to cardiovascular problems to cancers. If you have a patient, if I have a patient that comes in, and I look at the way they express themselves, I listen to the tone of their voice. If I hear that voice modulated, it's going up and down within a short frequency, but I know that patient, and I know that that's not who they are, I better start looking deeper, because it's telling me that there's something underlying that is going to manifest itself in a worse condition. So I'm checking what? I'm going to check their nails. I'm going to look at their face. I'm going to look at their tongue. I'm going to have them stand up. I'm going to look at the structural system. I'm going to look at all those pieces of the puzzle. And then I'm going to ask them different questions. Like, is it difficult for you these days to get going in the morning? Do you wake up in the middle of the night and where you haven't been before? And I look at, are they eating the way they're supposed to? Are they getting the fuel that they need to have? Do they walk up a single flight of steps and they're gasping for air where they weren't before? That could be a lot of different pieces of the puzzle. Sure, it could be a heart problem. Yes, it could be a problem with the lung, or it could simply be that we're not getting rid of carbon dioxide in the system because of the chemistry being shifted in the body, ultimately leading to worse problems over time. But join me on the 19th. We're going to have some fun with this. I'm going to show you what to look for, how to anticipate it, and it's going to make a big difference. I promise you. The more you know, and this is the big reason for this program on an ongoing basis, the more you know, the more you understand about yourself, you can ask better questions of your doctors, including me. And the information's there. The day of AI today, where everybody's on a computer, AI is only good as the guys that are programming it. And it gives them, all this. So they said, okay, let's try this. Let's do this. Let me know how you're doing and so forth. That's not enough. You need to really understand the signals and what your body's saying. And you're the final judge. You're the one that says, yeah, man, I'm really starting to feel good without the drugs. Yeah, I'm really starting to feel good. My body's starting to heal without the drugs. And if you can make that take place because you understand it and you're willing to take the next step, it's like right now we're in the situation where we're going to be looking at Robert Kennedy as the head of HHE, right? So here's the situation. This guy's not anti-anything. He's saying that you need to understand what is involved in bringing these products to market. You need to understand what the research that's there and then interpret it. Is it something that possibly could be affecting you? You have to understand that. Join me on the 19th. I promise you we're going to have a great night. And as always, please follow me on all the social media sites because I want to get you more and more data as much as you can. Follow me on Facebook. I'm always publishing things that are there so you can read them. Get on our email and we'll make sure that you get timely information ongoing. This is my journey, is to make you as healthy as I possibly can. Having said that, see you on the 19th. And I'll see you next week. We've got another program coming up that is going to be very specific, very finger pointing. And remember, I'm here for one reason. I love you all. Have a great Sunday. Take care. Bye.